So I am Dr. Prabjot Singh, and in this video we're going to learn about the anatomy of urinary bladder. Urinary bladder is a very important topic, be it exam point of view or MBBS exam or FMG exam or NEET exam. I am myself an FMG pass out 2018 batch, and and I have done my MD anatomy from AIIMS Jodhpur in 2023. Let's talk about urinary bladder. So urinary bladder is a pouch in which the body retains the urine. My video is basically from the exam point of view कि exam के लिए क्या क्या जरूरी है. Theory books में से cut the crap and just study this and you will pass. Okay, so let us talk about the capacity. Capacity is on an average 220 ml. It can vary from 200 to 300 ml, but average capacity is 220 ml. Now what is important from exam point of view is shape. When it is empty, it is tetrahedral, and when it is full, it is ovoid. And when it is full, it becomes abdominal, and when it is empty, it is purely pelvic. Not just abdominal, but we call it rather abdominopelvic. So this is an MCQ. Next important points. In children, approximately at the age of 6 years, it is abdominopelvic, because the pelvic cavity is small and it occupies a space even in abdomen. Then in teenage, around 15-16 years, it becomes completely pelvic. So this is again an important, and it's a potential MCQ. Okay, then next is about the surfaces. So when the bladder is empty and tetrahedral, it comprises of 4 surfaces, 2 inferolateral, 1 superior, 1 posterior. So these are your 4 surfaces, and when the bladder is full, it is ovoid and it comprises of 2 surfaces, anterior and posterior. Let us have a look. So this is your bladder when it is empty. It is somewhat like this. This is the superior surface. These are the 2 inferolateral surfaces, and on its back, like you have the 2 surfaces over here, inferolateral. This is the superior, and this one, this back, this is your posterior surface when the bladder is empty. Now when the bladder is full, it becomes ovoid. So in full, it has anterior surface and posterior surface. Important point to note over here is when the bladder is empty, the peritoneum is attached on the superior surface. So when bladder becomes full, the 2 inferolateral surfaces, they become your anterior surface, superior plus posterior, that becomes your posterior surface. So the peritoneum that was present in an empty bladder on superior surface is now present on posterior surface, and that is the basis of SPC. Let us have a look what is SPC. SPC stands for suprapubic cystotomy. So as the name says, it is suprapubic, so above the pubic symphysis. So when the bladder it is full, it becomes ovoid and it becomes abdominopelvic. So when there is when the patient is in ICU and we're having a difficulty in catheterization, or there is a failure of catheterization, we do something known as SPC. We make an incision we make an incision just superior to the pubic symphysis, and we install an external catheter through that incision, or we can even suck it with the help of a syringe if we just need to take it for one time. But usually we do the one in which we keep the catheter in situ. So that is SPC, suprapubic cystotomy. Okay. So what are the nerve supply? The nerve supply of the bladder is T11 to L2, main nerve supply, but it is having many more nerve supplies. Then it is having S2 to S4. Okay. So this is the SNS supply and this is the PNS supply, as well as the motor supply, which you can call. Okay. Now let us have a look at the nervous innervation of bladder. That is very important. I mean MBBS exam में theory question आता है. Write a short note on nervous innervation of urinary bladder. So this is very important from that point of view. So let us understand what is the nervous innervation. So parasympathetic is supplied by S2 S4 nervi erigentis. Sympathetic supply is from T11 L2, and voluntary or motor supply is from S2 S4 pudendal nerve. Okay, so now let us understand these further. The parasympathetic supply, it is, so before that just have a look over here in the bladder. Okay, before that, so let us have a look at the bladder. So it is so before moving on to the nervous innervation of the bladder, let us talk about the interior of bladder. That is very important. So you have the bladder. Before moving ahead, let us talk about the interior of bladder. So we know that the bladder is ovoid. It is ovoid in shape when it is full. So we need to draw a diagram in which we will have a look in which the bladder will be ovoid shape. So this is the bladder. Over here you have the bladder trigone. Okay, this is ureter, this is urethra, and this is bladder trigone. So what is it? So your ureters, they do not end up in the walls, they do not end up at the wall, but rather they come inside the bladder and end up over there. This is the site of opening of ureters that I am marking in yellow. So the ureters, they have a longitudinal muscle coat, and that longitudinal muscle coat does not end over here. That longitudinal muscle coat rather continues on the other side. So basically longitudinal muscles from both the sides are coming and are intermingling at the bladder trigone. So due to which a ridge is formed over here. This is known as bar of Mercier, that is interureteric crest. Similarly, you have another longitudinal fold that is formed by the longitudinal muscle coat of the ureter, but इसमें थोड़ा सा controversy है, but stick to this. So the one that I've drawn in blue color, this is Bell's bar or ureteric crest. And over here you have a bulging which is known as uvula vesicae, that is a bulge produced by the middle lobe of the prostate. So this is about the interior of the bladder, and the muscle of the bladder is the detrusor muscle that is having its own automatism. Over here you have a sphincter that is known as an internal urethral sphincter, and then over here on the terminal part of the urethra you have an external urethral sphincter. Internal urethral sphincter is involuntary. It is even absent in females. So it is present only in males. So इसका कुछ role होगा males में. It prevents retrograde ejaculation. So what happens is the ejaculatory duct, it opens in the urethra. Ejaculatory duct is formed by vas deferens plus the duct of the seminal vesicles that opens in the prostatic part of the urethra. So during the erection of the penis or during the act of copulation, the internal urethral sphincter, it basically blocks the opening of the bladder. It completely blocks the opening of the bladder, due to which the sperms, they only have one direction to move. They cannot move in the retrograde direction. So it is very important. It is playing a very important role in case of multiplication of human beings. So now let us talk about the nervous control. Nervous control is provided by the parasympathetic supply, that is nervi erigentis, that is having a root value S2 S4. Sympathetic control is by T11 L2, and then the voluntary motor control is by pudendal nerve. Pudendal nerve, that is again S2 S4. This is voluntary, or you can also call it as somatic. So what it does is, in this case, it causes filling of bladder. Sorry, my bad. It causes emptying of bladder. Sympathetic causes filling of bladder, and pudendal nerve, it provides the voluntary control. So what happens is, parasympathetic supply, it is causing emptying of the bladder, so it is causing contraction of detrusor and relaxation of internal urethral sphincter. Sympathetic, it is exact opposite of parasympathetic, so it is causing relaxation of detrusor and contraction of internal urethral sphincter. So during when the penis is erect, the sympathetic system is basically overpowering the parasympathetic system at that very point of time, and it causes the voluntary control of micturition. So it is basically controlling the external urethral sphincter. Let us understand this in detail. We have the brain. Now the spinal cord, and over here you have your bladder. So the spinal center of micturition is at S2, S4, and in the brain, on the medial surface, over here you have something known as paracentral lobule that is basically providing the voluntary control of micturition. Otherwise, if it would had been under the control of spinal cord, बच्चे सुसु करते हैं, जब देखो सुसु करते रहते हैं, वो होता रहेगा नहीं तो, ठीक है? So what is happening is, when the bladder is 220 ml full, it sends an impulse to the spinal center and it tells कि हाँ मैं भर गई हूँ, I need to empty myself. So this spinal center has the power to say the bladder, okay, release the urine. That is what happens in the case of the kids. But in adults, this is under the voluntary control by the brain. So the spinal center cannot itself command to micturate. The paracentral lobule will tell the spinal center, no, अभी micturate नहीं करना, अभी ये वॉशरूम में नहीं, क्लास में पढ़ रहा है, जैसे आप लोग पढ़ रहे हो अभी, कि अभी micturate नहीं करना. So when you reach the washroom, the paracentral lobule, it basically stops the voluntary control and says, हाँ ठीक है जो करना है कर. Then the spinal center, it tells the bladder, ठीक है खाली हो जा. That is how the micturition takes place. Now let us understand certain clinical conditions. One is atonic bladder, automatic bladder, autonomous bladder. In atonic bladder, there is loss of innervation of detrusor that causes complete relaxation of detrusor. So in atonic, what happens is detrusor is relaxed. Urine keeps on filling up in the bladder, and with time dribbling urination it starts. And if you press the lower abdomen of the patient, with such condition micturition हो जाएगा. Okay, automatic bladder. In case of automatic bladder, the connection between brain and spinal cord is hampered. So this connection is hampered. So जैसे बच्चे सुसु करते हैं ना, जब ब्लैडर भर गया, सुसु आ गया, because spinal center takes over the control. So in this case, spinal cord takes over control and micturition occurs like small kids. Okay. ऑटोनॉमस ब्लैडर में क्या हो रहा है कि आपका स्पाइनल सेंटर ही डिस्ट्रॉय हो गया है, गायब. तो ब्लैडर को इनर्वेशन ही नहीं आएगा, बिकॉज ब्रेन तो डायरेक्ट सप्लाई करता नहीं है, वो इसी के थ्रू सप्लाई करता है, तो कोई इनर्वेशन ही नहीं आएगा. इनर्वेशन ही आएगा तो क्या होगा? सिम्टम्स विल बी साइंस एंड सिम्टम्स सेम एज एटोनिक. ओके, बट इन दिस केस द कॉज इज destruction of spinal center. Most commonly that is seen in the case of trauma. That's all for the urinary bladder. Don't forget to like, comment, share and subscribe for more. And you can follow me on Instagram and you can write your suggestions in the comment section कि आप लोगों को और क्या देखना है. Bye bye. Happy learning.